So in adults, what are common dental problems that you encounter in your practice?
So interestingly, the way we talked about for children, a dental caries is such a big on the list, even for adults. And this the dental caries, the tooth cavities, as I said, you can also call them that, can come in form of pain. Like you have the dental cavity, and then now you're predisposed to having pain with the infection. And then also for even for children, just the same also for children, that it predisposes one to infection. So you can have an oral infection where now it can manifest with a swelling. You find someone has a swollen jaw or just around the gums. So we have dental cavities taking the bigger portion of the most common dental problem in adults. And then we have periodontal disease, what we call gum disease commonly, that the gums will bleed. And this is mostly because of buildup of the food debris around the gums, because of maybe we are not consistent in how we brush, or we are not brushing effectively. So food keeps packing around the gums and it irritates the gums. So what happens is that the gums will inflame, they will swell up, and they begin to become very, very delicate. I think when you brush them, they easily bleed. So you spit out blood, which is when you spit out blood when you're brushing, it's an indication that there's something going on. And you should never take that for granted, because this periodontal disease can cause to your teeth, whereby because the tooth is losing support over time, it starts just shaking on its own. Yeah, so that's why we also have adults losing teeth and becoming toothless. And then we have trauma. That is also a very common, especially in this age and era where we are using motorbikes, and sometimes we don't take in the safety measures to wear our helmets, and even in sports, the sports gear that we need to wear. So we have a lot of adults also presenting to the clinic with maybe, or even fights, like people getting into a fight, which is very common. Yeah, especially under the influence of alcohol or something like that. So we have adults coming with broken jaws or broken teeth. Yeah, and then also another common problem with among adults is halitosis, bad breath. Yeah, that sometimes someone's like, hey, I just got to the pregnancy when I wake up, or when I talk, there's just some bad breath. This can be attributed to, like, maybe there's a cavity already, so it's packing into food. So, and then the food ferments and constantly with that. Or maybe actually we are not brushing very well, because the tongue harbors bacteria. If you don't get to brush the tongue, you get to have the fall odor coming from our mouth. Yeah, and then of course it can also be signs of other systemic conditions, like or maybe some drugs that you're taking that also come with bad breath. So there are many reasons, there are many other things that can be attributed. And then also we are seeing cancer on the rise. So oral cancer is also something that is becoming very, very, very prevalent. Yeah.
Thank you so much, Dr. for that discussion about the common dental problems in adults. Are the prevention strategies or measures in adults different from those ones in children? And just tell us more on the preventive measures that adults can take.
Thank you so much for that. And it's a very relevant question. Yeah, and my take for that would be that they are more or less actually the same. Yeah, because we say that one of the issues that we face both in childhood and adulthood, the common problem is dental caries, which can be prevented by actually brushing very well, using the right brush, eating the right kind of food. So, so I would say for adults, the take will be the same, that they actually have to still brush the frequency after meals, at least in the morning after breakfast and evening. And then also for adults, flossing is something called a dental floss. Basically, you try to clean in between the teeth. Yeah, which can be a bit hard to do that on a child. But for an adult, you can be able to do the flossing. Yeah, at least before, like after the evening brush. Yeah, as frequently as you can. And then for also in terms to the diet, that's also very applicable for adults as well. That what we eat has a very big influence on just our general body health. Yeah, so we need to watch out not to reduce the intake of the sugars, the refined sugars in our diet. And substitute that for actually things like healthy, the fruits, the fresh, leafy vegetables that we can be able to, get access to. Frequently, drinking water frequently. That's also another good way to help rehydrate your mouth and to flush off any debris. And then another preventive measure for adults, the regular dental checkup is also a prevention measure in the sense that when something is picked up early, it can be solved, or you can advise accordingly. And then another thing about in adults, we sometimes actually abuse our teeth in the sense that you're somewhere, you have soda, and you have soda, and there's no opener, you're not finding the opener, and you just resort, or you're in the kitchen and you need to make tea, the packet of milk. So constantly doing that can cause something that's called attrition, or it can even, in that constant pressure on the teeth, can actually break that tooth. Yeah. So it causes some wear on our teeth. So we need to watch out, prevent by use a pair of scissors in the kitchen. Yeah, and for the soda, your teeth, you need to take very good care of your teeth. Yeah, and in addition to that, also when we are playing sports or using like the motorbike, it's very important for us to put on the safety equipment that we need to, so that we are able to protect ourselves from this. And then another very important thing that may come out still as a preventive measure, both actually for adults and for children, is our emotional and mental well-being, which is very important in the sense that for the children, sometimes children, because there's something called oral habits that children develop. Some of them can just be habitually, like sucking their thumb. Yeah, sucking their thumb. Sometimes it could be just because of an habitual thing that they're developing, but sometimes children who probably are trying to seek attention, or they just are brought up in a place where there's a lot of emotional trauma, they, in a bit to try console themselves, they start sucking their thumb, and for sometimes they can prolong that. And what that does, it actually pushes on it changes your dental the dental formula, in the sense that it pushes your front teeth very forward. Yeah, and then it pushes the palate, which is the inner part of your mouth, very, very more upwards, such that the shape will not allow for all the teeth to fit in. So trying to take care for the children to help to be able to grow emotionally healthy, so that they don't develop some oral habits that can actually alter the mental status, and also just their teeth and all that. And for adults, there's also something called bruxism, which also can be attributed to so many factors, but one of them also sometimes is maybe anger and aggression. So what happens is you begin to grind your teeth, especially in your sleep. Yeah, you begin to grind, and what that does, it literally actually grinds them. It can grind them to like to the lowest point. Yeah. So I think emotional and mental health is also a very important aspect of taking care of the prevention mission. And then of course, we also say that for adults also, the what we take also what we take affects our health, and that includes also alcohol. Consumption of alcohol and cigarettes, tobacco use generally has been associated with the increase in the cancer. So if we can be able to watch out also what we actually take, that is very, very important. Yeah.
Thank you so much for that discussion. It's been very educative, especially to our viewers. So, as we move to the end, what are these dental urgent conditions or emergencies that you encounter, both in children and mostly in adults?
So for children, the oral infection, which can be pain and swelling. Yeah, that is very urgent and actually is can be an emergency. Yeah, and that's also for adults that the pain and the swelling. Yeah, and even for adults sometimes, even for children, it can complicate to actually compromise your breathing. So actually it's fatal. Yeah, unchecked tooth issues can be fatal in the sense that now those oral infections and the swelling that compromise the airway. So we have the infections and pain that's urgent and can be an emergency. Then we have trauma of any sort. Yeah, that probably from a traumatic blow or a fall. Yeah, that is also an emergency. So like even for the case of a child, he or she was playing outside and fell and bleeding from the mouth. Yeah, it's very, very important for the parent to take to a dentist because something can be prevented, something can be helped. Yeah, and then another, maybe it may not be very an emergency, but it's urgent is like when you have the symptoms of gum disease. It's an indicator that you need to seek urgent dental treatment. Yeah, yeah, but I'd say pain and the swelling, the oral infection, they are very, very, very important.
Thank you so much, Dr. Ari, for that discussion on dental health. We really appreciate the information, and our viewers will really appreciate that and put it into practice, and it will go a long way to impact their lives and the lives of their families. So thank you so much. We wish you well in your endeavors as you continue to practice dentistry and impacting lives of different people that you serve. Thank you so much.
Thank you so much. Really honored to have been here and share this information. And just to encourage our viewers that there's so much about dental health that you can still seek from the right sources. Thank you and wish you all the best.
Thank you for watching this episode on dental health. Ensure you subscribe to the channel and hit the bell to be notified once we premiere. God bless you.